Alright, so we actually back on the past questions we're doing. That's in chemical pathology. So we have discussed carcinoid syndrome in depth on this channel, but we won't actually leave it out. We'll still discuss it because this is under past questions now. So here they said that you should discuss carcinoid syndrome under what definition, pathogenesis, clinical presentation, that's the signs and symptoms, biochemical investigation, and possible findings. That's possible laboratory. It's chemical pathology, so you always see possible laboratory, possible laboratory, possible laboratory. So carcinoid syndrome, on the first place, you see this is what the picture, and you just have to do it what there's overproduction of serotonin and some bioactive substances. Okay, so it's a complex associated with what carcinoid tumors, and it's characterized by what there's attack of severe cyanotic flushing of the skin lasting for a few minutes to days. The person will be having diarrhea and watery stools. There's bronchoconstrictive attacks. There's sudden drops in your blood pressure. There's edema and ascites. Okay, so symptoms are caused by what there's secretion of serotonin and prostaglandins and other biological active substances from the tumors, right? So these things have been secreted from the tumors, and that's what is actually causing what all those signs and symptoms there. So pathogenesis now, so they are usually small tumors, so less than 2 centimeters. Their growth rate is slow, all right, but they have what a possibility of metastasizing, that's spreading to other places. Okay, so usually in the liver, but it can actually spread to other places, right? So carcinoids are actually synthesize, they store and release variety of hormones and biogenic amines. So one of the best characterized of these substances is serotonin. So they also produce and secrete biological active substances like histamines, kallikrein, bradykinin, prostaglandins, dopamine, norepinephrine. All of them are produced like that. So midgut carcinoid release large quantity of serotonin. Foregut usually release what we form what serotonin. You understand? That's 5-hydrox. Alright, so the thing is, the midgut one is the one that produces the largest serotonin. Foregut is what to produce what we form serotonin. That's 5-hydroxytryptophan. Hindgut usually does not produce serotonin. You understand? So product of intestinal tumors are inactivated by the liver, but those from other side like the bronchus are released directly into systemic circulation, all right, in an active form, and that's what actually causes the symptoms that you usually see there. So carcinoid syndrome manifests after it spreads to the liver, okay, occurs, and there's release of serotonin and what biogenic amines. That means what the liver that was well, that was trying to now what inhibit some things, the liver is no longer there. Do you understand? The liver is affected, so the active substances, they just contaminate the whole body. So that's what usually brings up all the signs and symptoms you have there. Clinical presentation is what bowel obstruction and abdominal pain, diarrhea, that's watery stools, okay, flushing in the neck, head and neck, bronchoconstrictions because there's a lot of histamines coming in, right-sided fibrotic what lesions of the heart, okay, will lead to what right-sided heart failure. Biochemical investigations and what findings is you might actually want to measure what serotonin levels, serotonin metabolites, okay, that's what serotonin we form. Then also you want to measure the levels of what we form serotonin, that's 5-hydroxytryptophan. So you measure that in urine, plasma, whole blood, platelets. Their levels are increased in body fluid. So false positive are common if the person has consumed something that is rich in serotonin. So you always ask the patient which food they have eaten of recent. Okay. So examples of those serotonin rich foods include some medications contain it: banana, pineapple, walnuts, avocado, cough medications. So conversely, alcohol and aspirin and other drugs can suppress what? The serotonin metabolite concentration. So here is just a whole long story which you can actually pause to look at it. Alright, so we're just trying to look at what the possible test, possible findings. Okay, so if for me, I'm actually trained to be a surgeon, so all these possible findings, there's a way they usually bore me out. Okay, so you can just pause to look at it. So if there's a strong clinical suspicion of carcinoid syndrome despite normal levels of the 5-HIAA excretion, you should always estimate the other metabolites. Okay, so I think that's a fair one on carcinoid syndrome. I've made a whole 30 videos on carcinoid syndrome, so this one was just to answer an exam question. All right, so see you guys.